Hello all, welcome to my channel Weight Lecture. Today we will discuss multiple choice questions on veterinary pathology. Question number first. Dermatitis may be produced by the action of sunlight on certain photodynamic substance that may be present in skin is known as option A sensitization, options B photosensitization, option C frostbite, option D none. The right answer is option B, that is photosensitization. Dermatitis may be produced by the action of sunlight on a certain photodynamic substance that may be present in skin, known as photosensitization, while frostbite is an injury which is caused by freezing of skin or that cold condition. Okay. Question number two. Fat in the cells and tissue are usually stained by option A, osmic acid, options B, Sudan, third and fourth, option C, oil red O, option D, all. The right answer is option D, that is all. Fat in the cells and tissue are usually stained by osmic acid. Osmic acid is a crystalline oxide of osmium that is volatile, caustic, and strong oxidizing agent. It is used as a stain for neutral fat and myelin and as a general fixative for electron microscopy. Sudan third and fourth. Sudan third is lysochrome diazodide, which is structurally related to azobenzene and used for lipid staining. Sudan fourth are also called scarlet red and fat ponoqr or fat soluble dye, which is used for staining triglyceride, lipid, and lipoprotein that presents in cells and tissue. While oil red O is a lysochrome diazodide used for staining of neutral triglycerides and lipid on frozen sections and some lipoprotein on paraffin section. Okay. Question number three. Presence of fat on a ventricular endocardium give it is speckled appearance and it is called option A fatty infiltration, options B fatty degenerations, option C thrust breast heart, option D none. The right answer is option A, that is fatty infiltration. Presence of fat on a ventricular endocardium give it is a speckle, that is small spot or patch like appearance called fatty infiltration, while the accumulations of the fat globules within a cells of an organ such as liver and heart resulting in deteriorations of tissue and diminished functioning of affected organ known as fatty degenerations, while a condition of a heart in which the inner surface of ventricular wall and papillary muscles are strict and spotted seen in marked case of fatty degenerations, that is known as thrust breast heart. Okay. Question number 4. In xanthomas, the macrophages are laden with option A, glycogen, options B, hemosiderin, option C, cholesterol, options D, fat. The right answer is option C, that is cholesterol. In xanthomas, the macrophages are laden with cholesterol. Xanthomas is a skin conditions in which a certain fat build up under surface of skin. These are the raised waxy appearance, yellowish colored skin lesions that is associated with underlying cholesterol abnormalities. Since in above all options there are options fat and as well as cholesterol, so in between that fat and cholesterol we should go with cholesterol, but if there is no available of cholesterol then we should choose fat. Question number 5. To demonstrate glycogen, tissue must be preserved in the option A 10% formalin, options B formal saline, option C neutral buffered saline, option D absolute alcohol. The right answer is option D, that is absolute alcohol. To demonstrate glycogen, tissue must be preserved in that absolute alcohol, which is 100% alcohol. Question number 6. Deposition of carbon particle in lungs is referred as option A silicosis, options B siderosis, option C anthracosis, options D pneumoconiosis. The right answer is option C, that is anthracosis. Depositions of carbon particle in lungs is known as anthracosis. Depositions of silicons in lungs is known as silicosis. Depositions of irons in lung is known as siderosis, and deposition of dust particles in lungs is known as pneumoconiosis. Question number 7. Dash is the most common disturbance of cells metabolism and is the first reactions of cells to injury. Options A fatty change, options B hydropic degeneration, option C mucinous degeneration, option D albuminous degeneration. The right answer is option D, that is albuminous degenerations. Albuminous degeneration is the most common disturbance of cells metabolism and is the first reactions of cells to injury. When the injuries happens to the cells, the first degenerations is occurs in the form of albuminous degenerations. Question number 8. Brain sand is a dash type of hyaline change. Option A, keratohyaline. Options B, cellular hyaline. Option C, connective tissue hyaline. Option D, none. The right answer is option B, that is cellular hyaline. Brain sand is a cellular hyaline type of hyaline change. Since that pineal gland contain characteristic extracellular concretion. That concretion is mainly consists of calcium phosphate and carbonate in an organic matrix, which is deposited that around that pineal gland in concentric layer, that is called corpora arenacea or brain sand. Okay. Question number 9. Main target organ in aflatoxicosis is option A, liver, options B, spleen, option C, heart, option D, lungs. The right answer is option A, that is liver. Main target organ in aflatoxicosis is liver. Aflatoxicosis, ochratoxicosis, and trichothecins mycotoxicosis are the most commonly seen mycotoxicosis in poultry. Aflatoxin is the most common and highly toxic mycotoxin, which is mainly produced by Aspergillus flavus, Aspergillus parasiticus, and Penicillium puberorum fungus. This aflatoxin species consist B1, B2, G1, G2, out of which most toxic species of aflatoxin is B1 species, while ochratoxicosis is also mycotoxicosis, which is mainly caused by ochratoxin produced by fungus Aspergillus ochraceus, which is 3 times more harmful than aflatoxin B1, and it's majorly affect kidney. There are 4 types of ochratoxin, that is A, B, C, D, out of which A is more toxic. While trichothecin mycotoxicosis is mycotoxicosis, which is mainly caused by trichothecin toxins that include T2 toxin, diacetoxyphenol, nivalinol, deoxynivalenol extra, produced by Fusarium fungus, mainly cause immunosuppression. Okay. Question number 10. In infectious canine hepatitis, inclusion body is found in hepatocyte in location of option A, cytoplasm, options B, nucleus, option C, both A and B, options D, none. The right answer is option B, that is nucleus. In infectious canine hepatitis, inclusion body is found in hepatocytes in locations of nucleus. This actually that inclusion bodies are that abnormal or foreign cells or structures which is present within a cells. And if we see that intra cytoplasmic inclusion bodies includes Negri bodies, which is seen in case of rabies, Guianeri bodies, which is seen in case of smallpox, Pastian's bodies, which is seen also in case of smallpox, Bollinger bodies, seen in foulpox, Borel bodies, also seen in foulpox. And acidophilic intranuclear inclusion body includes herpes, polio, varicella zoster virus, yellow fever, and basophilus philic intranuclear inclusion body includes adenovirus. Both intranuclear and intracytoplasmic inclusion bodies are found in case of canine distempers, measles, etc. Questions number 11. In rabies, brain lesions reveals option A, suppurative encephalitis, options B, non-suppurative encephalitis, option C, both A and B, options D, none. The right answer is option B, that is non-suppurative encephalitis. In rabies, non-suppurative encephalitis is seen in brain. The major part of that brain that include Gasserian, ganglion, hippocampus, medulla oblongata, and cerebellum. And if we take that impressions smear from this structure, and when this smear stain with a cellular stain, then we can identify that Negri bodies. Okay. Questions number 12. Farsi is option A, acute form of actinomycosis, options B, cutaneous form of glandar, option C, subacute form of CBPP, options D, chronic form of CBPP. The right answer is option B, that is cutaneous form of glandar. Glandar is also known as Farsi or Malleus, is a highly contagious chronic disease of animal. characterized by formations of nodules and ulcer in upper respiratory tract, lungs, and cutaneous tissue caused by gram-negative bacteria, that is Actinobacillus melli. And while actinomycosis, also known as lumpy jaw, it is also chronic infectious disease mainly caused by Actinomyces bovis, as characterized by rarefying osteomyelitis of a bone of skull in cattle. And in case of pig, there is a tumor like enlargement of mammary gland is seen in case of pig. And in horse, there is a involvement of bursa of ligamentum nuchae. Okay. Contagious bovine pneumonia, that is CBPP, is an acute, subacute, or clinically inapparent or chronic disease, which is mainly characterized by formation of a massive pathological change, just like marked edema of interlobular septum, diffused pneumonia, serofibrinous pleuritis in thoracic organ, especially in case of lungs and pleura, is mainly caused by Mycoplasma mycoids. Varieties also mycoids. Questions number 13. Nasal polyps are caused by option A, Cystosoma nasalis, options B, E. coli, option C, Rhinosporidium sibiri, option D, Mycoplasma mycoids. The right answer is option C, that is Rhinosporidium sibiri. Nasal polyps are a soft, painless, non-cancerous growth on the lining of nasal passage or sinus, hang down like a teardrop or grapes. It mainly results from chronic inflammations and are associated with asthma, recurring infections, allergy, drug sensitivity, or certain immune disorder and Rhinosporidium severe infections. Questions number 14. Summer mastitis is caused by option A, Staphylococcal aureus, option B, Streptococcus uberis, option C, Corynebacterium pyogen, or option D, Candida albicans. The right answer is option C, that is Corynebacterium pyogens. Summer mastitis is actually caused by Corynebacterium pyogens, while cold mastitis or winter mastitis is caused by Leptospira species. Environmental mastitis is caused by E. coli, Streptococcus dysgalactia, Streptococcus uberis extra, and contagious mastitis is caused by Staphylococcus aureus, Streptococcus agalactis extra. Questions number 15. In pox, there is option A, hyperkeratosis only, options B, acanthosis and parakeratosis, option C, acanthosis and hyperkeratosis, options D, acanthosis, parakeratosis, and hyperkeratosis. The right answer is option D, that is acanthosis, parakeratosis, and hyperkeratosis. The pox virus is a viral disease which is mainly caused by orthopox in case of cow and buffalo pox, capri pox in case of goat pox and sheep pox, sweet pox in case of swine pox virus of family pox viridae, is mainly characterized by acanthosis. Acanthosis is a skin disorder that causes dark discoloration of skin, and parakeratosis, which is a conditions where skin cells get nucleated during keratinizations, and hyperkeratosis is a conditions where there's increased expression of keratin in skin cells. Let's see some common difference between parakeratosis and hyperkeratosis. Hyperkeratosis are conditions where there is an increased expression of keratin in the skin cells, while parakeratosis is a conditions where skin cells are nucleated during keratinizations. And if we see that expression of a keratin in case of hyperkeratosis is increased, expression of a keratin in case of a parakeratosis, there is a no change. Normal nuclei is present in case of hyperkeratosis, while in case of parakeratosis, there is an abnormal nuclei. And malignancy is not present in case of hyperkeratosis, while malignancy presents in case of parakeratosis. And if we see that inflammatory response absence in case of hyperkeratosis, while inflammatory response is present in case of parakeratosis. Questions number 16. Diabetes insipidus is under the influence of hormones released from option A, anterior pituitary, options B, posterior pituitary, option C, pancreas, options D, all. The right answer is option B, that is posterior pituitary. That ADH, anti-diuretic hormones, which is secreted by hypothalamus, stored in that posterior pituitary gland, released from posterior pituitary gland, act on that collecting duct of nephron of kidney. It's regulate water reabsorptions and balance, whose deficiency lead to that diabetes insipidus, which is mainly characterized by 3P, that is polydyspnea, that is excessive thrust, polyuria, excessive urine, and polyphagia, that is excessive appetite. Okay. Questions number 17. Metaplasia of oesophageal gland in poultry occur due to the deficiency of option A, vitamin A, options B, vitamin D, option C, vitamin C, or option D, all. The right answer is option A, that is vitamin A. Metaplasia of oesophageal gland in poultry occur due to deficiency of vitamin A. Let's see some deficiency disease of a poultry. Since vitamin A, that is retinol deficiency, cause nutritional drop in poultry. Vitamin D, that is ergosterol, cause rickets in poultry. Vitamin E, that is alpha tocopherol, cause encephalomalacia, that is crazy tick disease in poultry. Vitamin K, that is menadione, cause subcutaneous hemorrhagic blemish in poultry. Vitamin B1, that is thiamine deficiency, cause polyneuritis, stargazing conditions in poultry. Vitamin B2, that is riboflavin, cause coltoparalysis, club down condition. Vitamin B3, that is pantothenic acid, cause chick dermatitis. Vitamin B6, pyridoxine deficiency, cause hyperexcitability. Vitamin B12, that is cyanocobalamin, cause pernicious anemia. Folacin deficiency cause macrocytic anemia. Biotin deficiency cause cracked feet. Sodium chloride deficiency cause cannibalisms. And choline or manganese deficiency cause pyrosis or slip tendon. Okay. Questions number 18. Local dilation of artery is known as option A, aneurysm, options B, ball thrombi, option C, arteritis, option D, none. The right answer is option A, that is aneurysm. Local dilation of artery is known as aneurysms, while inflammation of artery, that is arteritis, a common conditions that develops when a sticky substance that is called plaque build up inside the artery, and it's a medical disorder that damage the lumen of arteries by plaque depositions, that is known as atherosclerosis. While arteriosclerosis is a disease that block the that lumen of arteries due to the thickening of the wall of the vessels, due to which is mainly seen due to aging, that is known as arteriosclerosis. Questions number 19. Spirocerca lupi may form dash in the esophagus. Options A, tumor. Options B, granulomatous lesion. Option C, abscess. Options D, dentigerous cyst. The right answer is option B, that is granulomatous lesion. Spirocerca lupi is also known as esophageal worm, which is a bright red worm, long and generally located within a nodules in esophagus, gastric, or aortic wall. Dog get infections by eating an intermediate host, that is a dung beetle, or transport host, that is chicken, reptiles, and rodent. This lesion associated with spirocercal infections include aneurysms of thoracic aorta, reactive granulomas of variable size around worm in esophagus. There is a note that dentigerous cyst, which is a common type of odontogenic cyst, which is a fluid-filled sac that develop in a jawbone over a tooth that has not erupted at. Okay. Questions number 20. 80-degree or more rotation of the intestine on the long axis of mesentery is called option A, torsion. Options B, intussusceptions. Option C, volvulus. Option D, none. The right answer is option A, that is torsion. Actually, torsion, in case of torsion, that intestinal bowels, there is a twisting of that bowels on its longitudinal axis, that causing a luminal obstruction. While in case of that volvulus, intestinal bowels, there is a twisting of the intestinal bowels on its mesenteric axis. Okay. And in case of intussusceptions, there is a inversion of one portion of intestine within another. Okay. Questions number 21. Glycogen infiltrations occurs due to disturbance in dash metabolism. Option A, protein. Options B, minerals. Option C, fat. Options D, carbohydrate. The right answer is option D, that is carbohydrate. Glycogen's infiltrations occur due to the disturbance in carbohydrate metabolisms. Let's see some degenerative changes due to that following disturbance. For example, when there's a disturbance of protein metabolisms, lead to that following degeneration changes like cloudy swelling or parenchymatous or albuminous degenerations, hydropic degenerations, hyaline degenerations, mucinous degenerations, amyloid infiltrations, and fibrinoid degenerations. While in case of that, when there is a defect in that carbohydrate metabolisms, that is lead to glycogen's infiltrations. In case of fat, when there is a like fat metabolisms get disturbed, then fatty degenerations, fatty infiltrations, obesity will occur. Questions number 22. Inflammations of tongue is known as option A, glossitis, options B, stomatitis, option C, proctitis, options D, gingivitis. The right answer is option A, that is glossitis. Since that ITIS terms itself denote as inflammatory conditions, let's see some organs and the terms that associated with their inflammations. Like bile duct inflammations cause cholangitis, gallbladder inflammations cause cholecystitis, where col terms stand for bile. Bone inflammations cause osteitis. Bone marrow inflammations cause osteomyelitis. Brain inflammations cause encephalitis. Cecum inflammation cause stiflitis. Cornea inflammations cause keratitis. Eyelid inflammations cause blepharitis. Fat inflammations cause steatitis. Gland parents inflammations cause balanitis. Lacrimal gland inflammations cause dacryoadenitis. Ligament inflammations cause desmitis. Lips inflammations cause uh, chilitis. Crops inflammations cause inguvitis. Lymph node inflammations cause lymphadenitis. Lymph vessels inflammations cause lymphangitis. Mouth inflammations cause stomatitis. Ovary inflammations cause ophoritis. Oviduct inflammations cause salpingitis. Prepuce inflammations cause prostatitis. Renal pelvis inflammations cause pyelitis. Salivary gland inflammations cause sialadenitis. Spermatic cord inflammations cause funiculitis. Spinal nerve root inflammations cause radiculitis. Uterus inflammations cause metritis. Vein inflammations cause phlebitis. Vertebral inflammations cause spondylitis. Rectum inflammations cause proctitis. Questions number 23. A malignant tumor of endothelium of blood vessels is known as option A, angioma, options B, angiosarcoma, option C, lymphangioma, options D, leiomyoma. The right answer is option B, that is angiosarcoma. Here's some that classification of a tumor. That squamous epithelium benign tumor known as papilloma, and its malignant tumor is known as squamous cell carcinoma. Glandular epithelium benign tumor known as adenoma, and its malignant tumor known as adenosarcoma. Fibrous tissue or connective tissue benign tumor known as fibroma, and is malignant tumor known as fibrosarcoma. Fat cells benign tumor known as lipoma. Fat cells malignant tumor known as liposarcoma. Cartilage cells benign tumor known as chondroma. Malignant tumor known as chondrosarcoma. Bone malign tumor known as osteoma, and malignant tumor known as osteosarcoma. Smooth muscles benign tumor known as leiomyoma, and is malignant tumor known as leiomyosarcoma. Striated muscles benign tumor known as rhabdomyoma, and is malignant tumor known as rhabdomyosarcoma. Blood vessels benign tumor known as angioma, and its malignant tumor known as angiosarcoma. Lymphoid tissue benign tumor known as lymphoma, and its malignant tumor known as lymphosarcoma. Okay. Questions number 24. Melena is the presence of a blood in option A, vomit, options B, stool, option C, urine, options D, all. The right answer is option B, that is a stool. Melena is that presence of a blood in a stool. Epistasis is that blood from that coming from that nose. Hematemesis means that blood which is seen in vomit. Hemoptysis means that blood which is seen in sputum. Enterohagia means bleeding from that intestine. Hematuria means blood in urine. Hemothorax means blood in the thoracic cavity. Hemopericardium means blood in the pericardium. And hemosalpins means bleeding from that oviduct. Questions number 25. Immunologically mediated glomerulonephritis does not occur in option A, chronic hog cholera, options B, Aleutian disease, option C, equine infectious anemia, options D, canine distemper. The right answer is option D, that is canine distemper. Except canine distempers, all disease in options like chronic hog cholera, Aleutian disease, and equine infectious anemia, immunologically mediated glomerulonephritis is seen. Okay, that is immune complex, antigen antibody complex, which is formed during this disease, cause inflammatory response in glomerulus, that is glomerulonephritis. Note that Aleutian disease, that also known as mink plasmacytosis, it's a disease which causes spontaneous abortions and death in case of mink and ferret. It's mainly caused by carnivore endoparvovirus first. Okay. Questions number 26. Principal immunoglobulin associated with delayed hypersensitivity reaction is option A, IgG, options B, IgE, option C, IgG and IgM, options D, none. The right answer is options D, that is none. Type 4 hypersensitivity, that is delayed type of hypersensitivity reaction, is mediated by cellular response, and while type 1st hypersensitivity reaction is mediated by IgE antibody, type 2nd hypersensitivity reaction, that is cytotoxic reactions, is mediated by IgG or IgM antibodies. Type 3rd hypersensitivity reaction is mediated by immune complex, while type 4 hypersensitivity reactions, that is delay type hypersensitivity reaction, is mediated by cellular response. Questions number 27. Dash is the inflammation of hip joint. Option A, coccytis. Options B, arthritis. Option C, gonitis. Options D, spavin. The right answer is option A, that is coccytis. Coccytis is the inflammations of hip joint. Gonitis is the inflammation of knee joint. Spavin is a degenerative non-septic arthritis of hock joint, characterized by appearance of three characteristic swelling. Arthritis is that inflammation of shoulder joint. Carpitis or popped knee is an inflammation of a carpal joint. Quitor, that is purulent inflammation of a collateral cartilage of a coffin joint. And pedal osteitis is that inflammations of third phalanx. Question number 28. Accumulation of edema fluid in that abdominal cavity is called option A, ascites, options B, anasarca, option C, peritonitis, option D, all. The right answer is option A, that is ascites. Accumulations of edemal fluid in that abdominal cavity is known as ascites, while generalized accumulation of that serous fluid in that interstitial space of whole body, that is known as anasarca, which is mainly seen in case of allergic condition, while inflammations of peritoneum is known as peritonitis. Questions number 29. Movement of cells from axial stream to that wall of the vessels is known as option A, axial flow, options B, reversed axial flow, option C, inflamed vessels, option D, both B and C. The right answer is option D, that is both B and C. Movement of the cells from axial stream to that wall of the vessels is known as reversed axial flow and inflamed vessels. Okay. Question number 30. Removal of the dead neuron by microglial and oligodendroglial cells is known as option A, neuronophagia, options B, satelitosis, option C, shrinkage, options D, chromatolysis. The right answer is option A, that is neuronophagia. Removal of the dead neuron by microglial and oligodendroglial cells is known as neuronophagia, while satelitosis is a usually abnormal clustering of one type of cells around another, especially that clustering of glial cells around neuron in brain during pathological state is known as satelitosis. Okay, that's much for